To continue on about facilitating telemedicine encounters, one aspect is website manner. So patient satisfaction throughout the literature is rooted in the communication, respect, and professionalism of the provider. And this is not an exception to telemedicine encounters delivered through technology. What we typically call this is your bedside manner, how you're able to interact with that individual, how you're able to understand their values and preferences, and actually do a patient-centered interview with them. This is considered website manner in telemedicine, actually making the patient feel valued, respected, and that they are have full communication for an opportunity to ask questions while you ask them questions, and it becomes a dialogue rather than a one-way communication. It's also really important to communicate what you're doing off screen. So say I'm communicating and typing on my computer next to me, and I'm not making eye contact, and you have no idea what I'm actually doing off to the side. It would be difficult for a patient to understand, trust, or figure out what you're doing. So it's important to say, "Hi, Kathy, I'm going to step away, or I'm going to be looking at my computer to pull up a patient-reported outcome measure for you. This will then appear on your screen, so please give me a second, and it'll appear on your screen for you to allow you to look at it." This lets the patient understand what you're doing. Or if you're taking notes and you're consistently writing down things, saying like, "I'm taking notes, I'm able to document this later," so you're able to understand. So I'm able to understand and do another telemedicine encounter with you based off what we talked about today. And this helps facilitate the flow in conversation. Throughout the literature, patient-centered interviewing has been formed through the tenets of patient-centered care. These interviewing skills are not about the clinician at all. So it's not about the mechanism, it's not about the past medical history. It's really about what do they feel, what do they want to get out of it, and what's their end goal. So it's important to establish goals for the encounter while establishing long and short-term goals for themselves. Maybe they don't want to get better. Maybe they don't want to get the care that you feel that they need. And this is where options in their care plan are very important. It's also important to do active listening, head nods, agreement, while not interrupting. Avoid medical jargon. Don't drop, "Can you please palpate your anterior talofibular ligament," understanding that they will not know what that means. It's important that you avoid that medical jargon and give clear expectations and instructions to the patient. Summarize the information. After you've done a medical history, relay that back and say, "Just want to make sure I'm understanding this right. This is what I have so far." And making sure that they agree with what they have gathered, or if they have any additions or things that you should remove that maybe you have misinterpreted. Avoid interrupting the patient. This is a key to telemedicine. Allowing the patient a time, have that moment of silence, as awkward as it may seem, that 1 or 2 seconds after they get done talking, allowing that to happen so you're able to communicate back and forth. Talk about the contextual factors. What's going on socially? What's going on psychologically? What's going on at home, in their family, at school? Understand all the other aspects to healing that are so important when doing patient-centered care. And express your concerns. Have this website manner. Express your sympathy, your compassion, understanding where they're at and what they want to do move forward. Understanding why they chose to do telemedicine encounters, why they did not go see a traditional face-to-face visit for an athletic trainer or physician. And encourage the patient to ask questions. Throughout the patient's interview or that consultation with them, encourage that question asking at during the subjective portion or during the goal setting, and making sure that you actually understand what the goals for that patient are. During the encounter, it's really important to understand the features available through telemedicine. So the options through double robotics, which is a telemedicine option. You can share your screen, take a photo for medical documentation, and do web page interactions where you can place a URL and allow that to pop up on the screen of the individual for them to complete. So, or you could also do this to do patient education. So if you're wanting to show them what is injured on their body, explain care options, places to go for care after, this is a great way to show them maps, show them diagrams, show them patient-reported outcomes, different things like that. There's also some features within other telemedicine to do a three-way call where you're able to take the patient, the one provider, and maybe a second provider or a family member and have them all integrate into a call together. There's also features for a sharing feature where you can send files back and forth, which is great for x-rays and radiology reports. So there's a lot of features that go along with specific platforms, and it's important to understand what you're trying to get out of your platform and what those features look like and are able to do. Through the modifications for your encounter. This is where it becomes a little critical or for you to understand Things don't always have to be different, but things may not be able to be done. So taking a thorough medical history does not change with telemedicine. A thorough medical history can provide so much information to you about the mechanism, the past history of the individual, what the treatment has been so far, what their pain level is at, different aspects like that, to really give you a clear picture of the injury for that patient. Also inspecting the area. Many of the high definition cameras allow you to have a clear focus on the individual. This allows you to do wound checks, dermatology checks, really see the area for redness, swelling, and bruising. And this gives you an idea of what stage or where their healing process is at. Doing patient-reported outcomes. This can be done a couple ways. You can do this, use this share your screen feature. You can have them access the link. You can read questions from a pro patient-reported outcome tool to them and ask them to identify which one they would do. But this could be integrated in to really help you understand their function and their disability in terms of their injury. Doing a gait analysis, having the patient walk around in the room. Palpations. This is where you're going to have to understand that the patient may not be pushing as hard or as soft as other areas. So just as you would normally start with a patient encounter, start at a place that doesn't hurt. Ask them to palpate their knee, making sure they understand where their finger is at and making sure it's on specific places. Then move your way up. Say you're going to the hip, and that's where the pain is located. Have them palpate certain structures, move their legs around, taking them through that ability to teach them what to do, just as you would be going through a patient encounter and pressing on someone immediately. So palpations are easy to do through telemedicine. It's just instructing them throughout the process. Range of motion can be done a couple ways. Active is makes the most sense if you don't have that telepresence or that facilitator with you. Active range of motion can be done with the patient lying down, standing up. You can do complete assessments back and forth. You understand there may be some lag time on the video, so understanding what that looks like prior to them you actually assessing. You can also have them move to in range, take a picture, and save that file, that picture, and then add some markers onto it to do an angle measurement after. There's great resources called like ImageJ where you can upload an image and it can measure it for you that are available for free download. And this can give you your range of motion measurements if you have a patient over a Christmas break, winter break, post-surgical that you want to follow up day by day. Strength testing is a little bit difficult, but you can still do. So having the patient push down and push up against themselves, while they may not be able to provide the correct pressure or the manual resistance, you're able to see if they're able to do it or if there's pain elicited with it, or if they feel like there's a difference on the sides. Circulatory function, doing a capillary refill at the fingers and toes would be something that you could easily do with a patient, having them press it and show their camera in the camera the whole time if you're able to see the capillary refill. Balance testing. Balance testing is something that may be integrated in, be able to be cognizant of the safety of the individual when you're doing so. Functional measures. These are things like hopping, skipping, jumping, different functional measures as such, doing a push-up, lifting something, holding something. So having some stuff in the room or located around them and seeing if they're able to complete some of those tasks. This will give you a lot of those strength measures that you may not have been able to assess. Using clinical prediction rules. So with special tests, some of them are difficult to do. And so if you're able to look at clinical prediction rules, say at the hip, 3 out of 5 of the positive signs for some of the hip special tests can correctly identify SI. So instead of going through the whole gamut of tests, if you have a clinical prediction rule, such as carpal tunnel, there's one for there, the auto ankle rules at the ankle, the 3 out of 5 cluster for the shoulder and for SI. So there's quite a few clinical prediction rules where you're able to really narrow down your focus for your special test into a group that really would give you a clear answer. Some of these special tests can't be done, and this is a limitation of telemedicine. When you're assessing some of these, say you're trying to do an anterior drawer on the knee, you can walk through the patient what you're trying to do. So pushing forward on their knee, so holding it down and pushing forward. If you're trying to test for laxity, this is something that's being a little bit difficult on themselves. They also will not know what laxity feels like, those in-feels that we are trained to do in athletic training. So eliciting pain is something that you can do if they're meant to be in a forced area or if they're supposed to put their arm in a position. such as like Hawkins-Kennedy, such as the clearing test for the FMS. You can totally do one of these. You can have them do all the clearing tests for the FMS, for like the Cobra pose for low back, and go through some of those measures together to really understand. I may not be able to do the special test as I have learned it and as the textbook has created the reliability and validity for that test, but I may be able to integrate it in through telemedicine in a way that elicits some information for me in terms of what the limitations or what motions are reproducing the pain or limitations for that individual. And the last part is ending a telemedicine encounter. So communicate a diagnosis, whether that's a differential or a specific diagnosis, but you have to communicate something to the individual if you're doing an orthopedic exam, a general medical exam for the first time. So if you're doing one of those first time encounters, if you're doing a follow-up, provide the information that you've gathered and actually follow up with them. Give them the information to tell them where they're at in their stage of recovery, what the information that they really have gained, you have gained from this consultation, and actually reflect back on their goals. What was their goal for having the telemedicine encounter, and did you meet their goals, and what information can you provide back to the patient? Provide an immediate care plan, whether that be take a leave today, do some ice, active rest, get on a bike, whatever that may be. Don't do anything at all. That is your immediate care plan, but it needs to be communicated to the patient in terms of what to do. Discuss their goals for care. Ask them what they want to do moving forward. If they have no desire to do care right now because of time, work, money, explain to them that that's fine, but also explain to them what the risk of doing that looks like. And this is how telemedicine is able to have a very emotional connection for individuals. They may not feel that way, and they may feel that the presence of a provider or clinician in the same room may feel the way that they have to do that care. Through telemedicine, it creates a sense of comfort that they are able to talk in a manner that may feel more comfortable to some of them, especially for individuals that have some anxiety or stress related to doctor's visits, that white coat syndrome. This removes that kind of stigma related with it. Explain the next steps, provide supporting materials. They provide links or follow-up communications with the individual in terms of this is what your care plan is, this is what your home exercises will be, this is your modifications. Your next appointment, explaining how if you want to do it in telemedicine or if you want to see them in the clinic face-to-face. Those are all really good things to incorporate in. Finally, announce the end of the visit. Once you are done, say, thank you, Kathy. I really appreciate you joining me today. This is going to end our call. And they could say, thank you, I appreciate your time. And you say, you can disconnect now. And then allow them to disconnect before you do so. Often at the end of visits, just like in a traditional visit, a traditional encounter with a physician or an athletic trainer, our patients have tons of questions right at the end because they know we're about to leave. Wait for your patient to leave. And that allows them to ask those last minute questions that may have just come up or they didn't get answered just right that they really want to know. That allows the patient-centered care and that ability for you to really engage with that patient for follow-ups. Finally, it's troubleshooting. If something goes wrong during a call, don't freak out. Have a clear plan. Talk through the issue if the audio is still working. The best thing to do, though, is at the beginning of a telemedicine encounter, right before it starts, actually exchange phone numbers. Explain who's going to call if something goes wrong. But if the call disconnects all the way or if it freezes, you need to restart. If it's still working or if it's just kind of going funky, if it slows down or it's not a clear connection, check your internet connection. Make sure they actually know how to activate their video. Consider the browser. See if it works best on Chrome versus Mozilla. Doing a hard reset. This may take a little bit of time on both ends, but if that needs to happen, understand that it's either we need to reschedule our visit or this is a way that we can redo the call, and I will call you when the computer and the telemedicine platform is ready. Understanding of icons and buttons. Just as I said before earlier, understanding that what the power button looks like or how to end the call, what that looks like. So understanding that a red phone probably means hang up, and making sure your patient understands that and not assume so because you think that. So hopefully this gives you some clear details and information. This is an example of a telemedicine call using the double robotics. The one on the left is a traditional face-to-face encounter. The one on the right is with double robotics. While they may be a little bit different in terms of what that looks like, the patient still has the same opportunity for you to engage with them, and that's what I encourage you to do so. Use your thorough medical history and some of the skills from athletic training to really provide a patient-centered care. Thanks.